If you can imagine with me driving down the highway and the fog is so dense that you have your windshield wipers going back and forth, but they don't help. And you can see maybe 3 feet in front of your car, and there's that sense of, I don't know what's around me, I don't know what's out there, and I don't know what's coming. That's how it often is when people are diagnosed with an illness.
Sometimes when people call me, I can sense desperation in their voice.
A nurse navigator helps people find their way.
ConnectCare3 was formed really by our president based on an unfulfilled need. He was diagnosed with a brain tumor several years ago and realized as he was trying to navigate through the healthcare system how challenging it was without an advocate there for him.
It was devastating. Fortunately, it was benign, and all that I had to do after that was to survive the recovery, which turned out to be a lot worse than what I thought. For over a year, it was really a very tough recovery. What became obvious to me is that doctors, hospitals become a business, and they are paid by giving procedures, and they're not paid on results. Having someone by your side who is your advocate, who can actually question what's happening within the medical community is very, very important.
I'm typically the first point of contact for ConnectCare3, and when someone calls ConnectCare3, they talk to a live person. Typically, one of the first questions is, what would my insurance cover? You can hear the relief in their voice when I can have those answers for them.
The most important ingredient in ConnectCare3 is that medical navigator that is doing the research for this patient.
The thing that makes ConnectCare3 such a unique service is we will be meeting with our patients and their families face to face.
We take away that fog. The fog dissipates because we can say, these are the different roads that you can take to get to the health that you want to have. You can go locally, we can find nationwide centers of excellence. You can go aggressive, you can go simple, but we can help you find that road that you want to take.
In my case, the advocate could have at least educated me on the options. I always wonder if I could have had surgery done in another location with a more progressive type of a treatment regimen, maybe my recovery would have been 6 months.
When we do surveys with patients, people never say they have too much information. They're always looking for more information.
What we can do is really sit down with the patient and gather and assess all of the medical information that they can provide us with. We will organize that information for them so that we're aware of perhaps if they've had treatment in the past, where have they gone for that treatment, the names of physicians, where is the best treatment facility for you? How is that going to impact you and your family? Provide you with the research and education that you need to be able to make the most informed decision.
We're not going to take away the disease, and we're not going to take the challenge of making decisions, but we can provide some peace and clarity of mind because of information.
Secondly, they would hear what we can do from our social services. When I talk about social services, it's as rudimentary as their husband or wife has never been able to balance a checkbook. So now they're critically ill. Who's going to balance a checkbook? Where our people would have to help train how to do that.
It can be very expensive if you have a loved one in a facility many miles away from your homes and to stay in a hotel. Oftentimes we learn of residents within a city that are willing to house individuals.
We will help patients get to their family doctors if they need to, if they would like us to accompany them to their family doctors. We will help them interpret their diagnosis, understand their diagnosis.
And thirdly, there is the process where we will take the total case and we will push that to a review panel of an expert clinician who specializes in their treatment need to make sure that not only are the protocols correct, but are there other areas where this person could actually go for more advanced treatment? So the three-pronged service is just that.
The significance of that study was really pointing out that patients who had advocates did do better.
So our study was set up to look at 2 years of patients who were enrolled in the program and compare them to a group of patients who were not enrolled in the program. And we did find that patients who were enrolled in the program were significantly less likely to be hospitalized than the patients who were not. When you end up in the hospital, it's often a big disruption in your care. Keeping people out of the hospital is good for the healthcare system, and it's also good for patients. As a physician, I think your health is the most important thing you have. Without your health, you have nothing. And I think our healthcare system is very, very challenging. Even for myself, with my own family, I often have a hard time getting them through the system.
Simply pick up the phone and call us. We have a toll-free number that's available.
And I think at the time that you're diagnosed is often when you need these services the most.
That's what I would want. If I'm sick, I want somebody pushing the envelope to find out where can I get the very best treatment.
If you never actually need the services, that's terrific.
But if you're critically ill and you're looking for help, that's where we come in.